Hello, my name is Addie Majnaric, and I would like to present my case study today on a 41-year-old female. The patient was referred to me by a physician due to weight loss goals. This was a outpatient um, appointment, and it occurred on October 29th, 2016. So there is no admitting date or admitting medical diagnosis other than patient's needs for weight loss. Just to give a little bit of background on the patient, as stated, this is a 41-year-old female. She is a mother of two teenage children. Just some history on the patient's weight status, since that is the nature of the appointment. During college, the patient stopped playing sports. She was very active in high school, and that is when she began to see some of her struggles with weight and fluctuations thereafter throughout her two pregnancies, and since those children being born. She is not physically active right now, and struggles with weight, and making healthy choices with food, as well as being regularly active. So to begin the assessment on the patient, after speaking with the patient, we retained a diet recall, a general idea of what she typically eats in her day-to-day life. For breakfast, usually no food is consumed. She may grab a latte or cappuccino when dealing with dropping off her children for school or what have you. She'll have a mid-morning snack of typically a donut with some 2% milk. For lunch, she may have a peanut butter and jelly sandwich on white bread, accompanied by a piece of fruit and usually with some sort of soda. For an afternoon snack, she'll usually have some cookies and milk with her children when they come home from school. For dinner, patient reports that she'll typically either have a hamburger, chicken, potato salad, or scalloped potatoes, and then accompanied by some corn or peas, as well as a green salad with ranch dressing. And she usually will have some dessert of some kind, usually ice cream or pudding or jello, and will drink water with this meal. And then she usually has another little snack before she goes to sleep, which is usually chips with dip of some kind and juice. After plugging all of this into nutrient analysis, I came up with an estimated kcal of 2,985 for her typical days. Again, this is just an estimate to get an idea of typical intake of the patient. Again, there's no inpatient diet order. Patient is very independent, able to feed herself, with presenting with no oral problems. For a physical assessment, no signs of malnourishment. Patient is well developed and well nourished. Then to go on to some anthropometric measurements. The patient is 5'6", coming in at 178 pounds, which is her usual body weight as of late. With the Hamwi equation, I calculated her ideal body weight to be about 130 pounds, with her being a 5'6" female, 100 pounds for being 5 feet tall, and 5 pounds for every inch after, with in equaling out to that 130 pounds. Some weight history. About 20 years ago, she was 140 pounds, and as stated before, has had some fluctuations both up and down since then, but coming out to be 178 now. This weight change is not very significant, about 27%, which has taken place over a 20-year period. And while the change in weight is not significant, her weight itself for her height is concerning. She comes in at a BMI of 28.79 kilograms per meter squared, which classifies her as an overweight individual. Her waist circumference measured at 38 inches, which also puts the patient at a high risk for diabetes, coronary artery disease, and hypertension. Um, and according to her percentage of ideal body weight calculated, she's at about 137% of ideal body weight, of that 130 pounds talked about previously, which then classifies her as obese. And her BMI is approaching that obese cutoff point as well. So there are some concerns accompanied by her weight. There were some lab values obtained. I will just touch on the 4 abnormal lab values that I saw. Her fasting glucose had her at 126 milligrams per deciliter, which puts her as classified as diabetic. It would be a good idea to maybe retest this again and maybe in different forms of testing her blood glucose levels. Her HDL was low at 38 milligrams per deciliter. Her LDL was high at 119 milligrams per deciliter. And her triglycerides were also high at 189 milligrams per deciliter. There are no previous surgeries or procedures or tests that she has gone through in relation to her nutritional status. Past medical history, just that the patient has given birth to 2 children, but they're in their teens now, so this was quite some time ago. The patient is not on any prescribed medications. She does take a 1-a-day multivitamin on the regular. No skin status to report on. So after some calculations, I estimated her nutritional needs based on her 80.9 kilogram weight to be with a resting energy expenditure of about 1,491 kcal, and with a total energy expenditure with that activity factor of 1.3 calculated in to be about 1,938 kilocalories, and those are both calculated with a Mifflin equation. A normal range for kcals per kilogram is stated to be about 25 to 30 kcals per kilogram for her age. But like I said, for her body weight, her current kcal per day for weight maintenance is about 1,938 kcals. Her calculated energy or protein needs, is at usual 0.8 grams per kilogram. At her total weight, that would put her at 64.6 grams per day. Fluid intake for this patient should be about 35 milliliters per kilogram, which has her at about 2,826 milliliters per day. And to touch base on all of this pertinent information, some concerns arise for metabolic syndrome for the patient, just because she is meeting the 3 or more criteria of a waist circumference greater than 35 inches, triglycerides being greater than or equal to 150 milligrams per deciliter, her high density lipoproteins is less than 50. Her blood pressure was over 130/85. She presented with a blood pressure of 140/90. And again, as stated, to add on to the metabolic syndrome status, her fasting plasma glucose level was greater than 110, actually coming in at about 126. So that is an additional concern for the importance of this nutritional intervention for the patient due to the presentation of that metabolic syndrome. To continue on with this, I have developed 2 PES statements to diagnose this woman. First being excessive energy intake related to food and nutrition related knowledge deficit concerning energy intake, as evidenced by intake of energy in excess of estimated energy needs by around 1,000 kcals per day from reported food history, intake of high caloric density foods, and a history of weight gain over the past 20 years of about 38 pounds. My second PES statement would be overweight or obesity related to excessive energy intake and physical inactivity, as evidenced by her BMI of 28.8 and a percentage ideal body weight of 137%. For an intervention, I would come in with nutrition education, particularly in relation to those abnormal lab values, dealing with her fasting plasma glucose of 126, and her abnormal cholesterol levels due to implications of lifestyle disease, nutrition education in regards to her choices of high calorically dense foods. We would focus on a weight loss of 1 to 1.5 pounds per week by decreasing her daily kcals by 500 to 750 kcals, per day. Due to the patient's history with dieting and weight gain, this slower controlled weight loss will hopefully be more effective in helping to change some dietary habits and making those lifestyle changes. Also going to encourage the patient to increase her physical activity whenever possible. Also going to do some education on importance of those dietary and lifestyle changes to address the multiple factors present that classify the patient as having metabolic syndrome. The TLC diet and education on it may be implemented due to severity of metabolic syndrome factors. I think the TLC diet may be helpful to address some of these concerns, in particular her cholesterol levels, as well as intervening on those presentations of potential diabetes. So for monitoring and evaluation of this patient, I would continue to do food diary observations at our next appointment to check in with the weight loss, and hopefully there will be no gain to report on, but just to check in with those anthropometric measurements. And criteria, just following in regards to her food diary reports, if she's following those food or nutrition education interventions in regards to her food choices, as well as total kcals per day for weight loss, to see if she's meeting that 1 to 1.5 pounds per week until that ideal body weight is maintained or closer to that ideal body weight is seen. And then observation of any of those previously abnormal lab values once some of the weight loss is occurring. Thank you very much for your time. I appreciate you.